كانت البداية رؤية ترنو إلى تحقيق تحول نوعي في الرعاية الصحية وبمرافقنا المتطورة والممتدة على مساحة 45 ألف متر مربع، مع وصول مريح إلى خدمات متخصصة من مستشفيات M42 المرموقة، نقوم بإحداث نقلة نوعية في صحة المجتمع. من أفراد قواتنا المسلحة وعائلاتهم إلى الشريحة الأوسع من مجتمعات الإمارات الشمالية، نؤمن بأنه ينبغي وصول الجميع إلى أعلى مستوى من الرعاية الجيدة من أجل غد صحي أفضل. بالشراكة مع وزارة الدفاع نقوم بدعم الابتكار في الصحة من أجل الناس والكوكب، وتقديم رعاية عالمية المستوى قريبة منكم. يشرفنا أن نؤدي دورا في تمكين الناس من فرصة حياة مديدة وسعيدة. مرحبا بكم إلى مستقبل الصحة. مرحبا بكم في مستشفى الشيخ سلطان بن زايد.
Yes, this definitely deserves a big round of applause. We are very excited that on the 1st of January, this new hospital opened. And we really want to make sure that here on day 4 at Arab Health 2025, on the M42 main stage, because M42 is partnering up with the Ministry of Defence behind this hospital, we want to hear a lot more about the facilities, the services, and the smiles that we saw there in the video. The speakers I'm going to introduce to you who are gracing our stage, you'll recognize them as featuring in that video because of course they come from the leadership behind the hospital itself. I feel like the music of Arab Health 2025 is built to a crescendo as I introduce them. May I please ask to return to our stage a fantastic Emirati role model for many of us. She spoke very powerfully here yesterday in the opening panel discussion. Safeya Mqtri, the CEO of Dubai and Northern Emirates, and the Managing Director of the Sheikh Sultan bin Zayed Hospital. Welcome back, Safeya. And a good friend now, wonderful lady. And may I please also ask Dr. Abdalla Rashid AlNaqbi, the Managing Director and Consultant of Critical Care and Internal Medicine at the Sheikh Sultan bin Zayed Hospital, to also join us. Thank you so much for your time. This is remarkable. They have very busy day jobs, but they're going to take some time out to speak with us today. And I'm going to hand the baton over to an expert moderator. She's been with us throughout Arab Health 2025. Dr. Rizwana Papatia, the Senior VP of Medical Staff and Clinical Strategy at M42. A wonderful panel for you all. Please enjoy and take over.
Thank you so much. Thank you to the audience. Thank you, Safeya. Thank you, Dr. Abdalla, for being here. And today's session will focus on the strategic partnership between M42 and the Ministry of Defense that paved the way for a very exciting venture and launch of Sheikh Sultan bin Zayed Hospital at Al Bataya, Sharjah. And this hospital caters and serves the need of the wider Northern Emirati population, apart from serving the military personnel. So thank you so much for your time. Let's start with you, Safeya. So it has been a wonderful experience. It has been a beautiful hospital, and that has been initiated from January 1st. What is your strategic vision as a leader of this organization and hospital?
Thank you, Dr. Rizwana. First of all, Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. I'm truly happy to be here because this is a true mark in the timing of the hospital. It's 4 weeks since we opened our doors. We opened on the 1st of January under the name of Sheikh Sultan bin Zayed Hospital. A remarkable milestone for the UAE, for M42, for the Ministry of Defense and our partnership. So I'm truly honored and happy to be sitting on the stage to talk about this new venture between M42 and the Ministry of Defense. Now, in terms of the strategic vision, let's take a step back and look at where this idea came from. This is a remarkable partnership, as it is the first of its kind between the civilian and the military sectors, collaborating in the medical field, in the medical field, and opening a healthcare facility in the region. I think there are 4 or 5 examples around the world. However, in this region, in the Middle East, this is the first of its kind, and I'm truly honored to be part of that team that has successfully delivered that partnership under the umbrella of M42. Now, this hospital came also as a direction from our leadership. It reflects the commitment of the UAE leadership's commitment to provide world-class care to all citizens, to all Emiratis and citizens on this land. It opens capacity, new capacity. So the idea was to open the capacity of the hospital, which previously was only catering to military personnel. So it opens now new capacity to the communities around, to the northern regions, and hopefully will be supporting that community with the expansion of services.
Thank you so much. It's a very, indeed, a remarkable journey, and exciting times ahead to set up and expand services at Al Bataya. Dr. Abdalla, so now M42 has ventured into the Northern Emirates region, and this is the first flagship hospital in the Northern Emirates region, which also has expanded beyond the population it served before, which was the military personnel. Now it is open for civilians. How do you think, or what is your vision about the hospital? How will it address the needs of local community in Northern Emirates? Thank you.
Thank you, Radwana, for inviting me in this meeting. As you started earlier, I think I used the same word used by Safeya earlier, just to local community. We are local, they are local people, they are looking for world.
Dr. Abdalla, keep the mic closer.
Local community is looking for world-class service, and I don't think anybody proved bringing experience from outside the country to inside the country and implementing good business model as M42 approved it for the last many years. So the local community was looking for such a service to be available and accessible to them. The hospital is unique in its location by itself. It's just surrounded by 3 main highways. The Emirates Road, Sharjah Khorfakan Road, Fujairah Dubai Road. So it's easy accessible to everybody for the whole North Emirate. I would say it's more accessible than any other hospital. So you are 45-minute drive from Ras Al Khaimah, Ajman, Al Qawain, Sharjah, name it. Regardless of your traffic, you are on a highway where you can reach the service you need it. I would think as a hospital for the local needs, it's a lifeline. So when people would like to have the hospital, they shouldn't be sick exactly. It can be used for preventive, second opinion, confirming a diagnosis, changing the services. So the ease of access is the top priority, and that's what was achieved by the location and the world-class service, which is achieved by the M42 partnership. Then the other service provided in the hospital. We were restricted previously by the military population only, and we had many requests which unfortunately we couldn't serve previously, but now we'll be happy because many military services or family would like to have his neighbor or his anybody from his neighborhood to come and have the same service as he had previously. So thanks for M42, this chance for the whole population. So as I said, the accessibility is becoming much easier. Good call center. You can book the whole day until 10 p.m. Someone is answering your phone, arranging your appointment. I think I'll speak about the available services later, but I think the accessibility and the quality of service will be available. This is what the local community needs.
Thank you, Dr. Abdalla. You brought up very valid points. So first is the strategic location, which can serve wider community of Northern Emirates region. And this hospital has a remarkable capacity to serve from preventive medicine to secondary, tertiary care services that can be provided. I will extend the same question to you, Safeya, about how does this partnership between the Ministry of Defense and Sheikh Sultan bin Zayed Hospital aims to redefine healthcare than what it provided previously to both the military personnel and the community needs of Northern Emirati region. What is your vision, or what are your thoughts on that? Thank you.
Sure. I mean, building on what Dr. Abdalla mentioned, once you expand the population of patients that you can see, you enable better service, you enable the clinical teams to see more patients and upgrade and upskill their teams. So hopefully the addition of new volumes, new communities coming to the hospital will enable that expansion of services. Now, we had a plan to, and we leveraged day one of this hospital to expand the M42 services and bring them closer to patients, similar to, for example, the opening or offering of services for Imperial College London Diabetes Center, Amana Healthcare, bringing their long-term care services closer to the northern regions. Today we have patients all in Abu Dhabi that can go back closer to their hometowns, whether it's Fujairah, Ras Al Khaimah, Ajman, and receive their care through the hospital. We brought the services from Health Point Hospital, Mubadala Healthcare, or Mubadala Health Dubai, all under one roof, under one umbrella, which is Sheikh Sultan bin Zayed Hospital. And that will enable us to offer more services for both, for the military personnel and for the communities surrounding it.
Thank you. Dr. Abdalla, can you tell our audience more about, any innovation, any innovative technologies or any patient care strategies that you plan to implement or initiate at Sheikh Sultan bin Zayed Hospital to ensure, as you and Safeya rightly mentioned, high quality, safer, and innovative care to the wider public of Northern Emirates and UAE?
Like my self-understanding about the innovation to be used in healthcare services comes from what's your goal? It's not something to serve one single population. It is something to improve the workflow, to help you support bigger population, to help you to support safety, improve your quality, improve your auditing, and so on. So it's not something, it's not everything coming from technology. It's like simply applying a new strategy in quality, which shouldn't be something from technology. I would say about my structure of the hospital, I have 221 beds that need excellent system, from health information system, with a good team to run that system, with implementation of any new technology, and like making the discharge summary faster, making recording the result faster. This kind of a simple innovation make big difference in bigger population. This is about 221 bed. I'll move to my 6th theater, which is state of the art. Simply, I would see it within a year or two. Probably we're implementing robotic surgery. So instead of having the surgeon come to us for a specific surgery, he would do it for us from wherever location he's available to us. And so on. Move to any service, you can have some area of improvement in our hospital. If I have the chance, I would say within 5 years in this hospital, the whole 220 bed hopefully will be all occupied. The whole 6th theater, including robotic, will have a very automated system with artificial intelligence for booking or changing appointment, making the flow faster and better. Will be having better system using the artificial intelligence to edit doctor work, so we'll have better quality result faster, and will give like objective result for something used right now only in subjective way.
Thank you so much. So, Safeya, many of us have visited the hospital, and everybody who has visited Sheikh Sultan bin Zayed Hospital is extremely impressed by how big, how beautiful the center is. And it has over 200 beds with emergency room, ICU, inpatient beds, long-term care facility within it, and outpatient facilities, rehab. What are your thoughts apart from, as you mentioned, that we are trying to integrate all the M42 services like Imperial College endocrinology services, long-term care services, renal and dialysis services. But what do you think are your thoughts on, like, what are your dreams on the expansion plans or service lines of this hospital?
Yes, it's a really, really nice building. I think the Ministry of Defense has done a phenomenal job building this hospital, the infrastructure, the technology that was used, the medical equipment, investment in medical equipment has been significant. So it opens opportunities for so much more to be done. You mentioned the day one priorities were to bring the M42 experience outside of Abu Dhabi closer to patients. We have more than 20% of our patient pool in Abu Dhabi driving all the way from northern regions, from Ras Al Khaimah and other areas to receive care in some of our facilities. So that was our day one priority. Now, in the future, we thought it's important to understand the community around us. We have a couple of ideas. However, it's important to know what is the market demand. I think, first of all, we will need to focus on women's health, for example. That is a key area that can be and should be expanded now that we are open to the community, introducing, for example, gynae services. Pediatrics is a second area that we are considering and looking at. Dialysis as part of our network. Diaverum is offering these services. We recently, Diaverum launched their services in the Emirate of Abu Dhabi through ICLDC, and we're looking to reinitiate this service, which was previously available at the hospital. So we will look into launching these services in the future. I think the sky is the limit for Sheikh Sultan bin Zayed Hospital. There's huge potential, there's demand, there's hunger for better service. We're receiving, we were talking about the demand for the hospital. We anticipated a certain number of calls in the first week. And we were surprised that we received 4 times these calls in the only first week. So there's attention from everyone. They want to come to see our services and receive care. And we'll analyze this demand and the request and hopefully be able to meet the demands of our people.
Thank you. Thank you. So the feedback we have heard about the hospital from the staff, from the clinicians, and from the people have been very excellent. Like, they love working at Sheikh Sultan bin Zayed Hospital. That comes, Dr. Abdalla, with the responsibility, to cater, to continue maintaining that quality of services, to ensure a safe, equitable, and a quality-driven, evidence-driven patient care. How do you anticipate continuing with this kind of exceptional, high-quality care services at hospital?
For me, as a medical director, I like the concept of center of excellence. So I like the idea of center of excellence. So you don't have to reinvent the wheel again. You start where others end. So we have many good examples here, like as she said, Imperial College Diabetes Center. So people, when they will arrive to our hospital, they expect either better care or similar care. And they will be the first people to audit me and to give us the feedback, like what's expected and what's available to them. So as I said, it's center of excellence. You have to fulfill all requirements. You have the infrastructure, we have the basis, we have the population who's having this service in different locations, and they are willing to move to the service in our location. So unless we make it and better service, and just to get the idea from people who has the experience to pass it to us, will not do it in a right way. So we'll not consider ourselves the expert in everything. We should have the expert who teach us or show us how to do it in the best way.
Thank you. Safeya, I will pass that same question to you, that you have delivered this project in a record-breaking time in such an exceptional manner. What do you think are the challenges that you anticipate on to maintain this, to maintain the expectations of the general people, the staff, and in the same time continue to expand the services? So what challenges do you anticipate, and how do you think would you address them?
I think this partnership is a case study of bringing two major players, two different cultures together. It's a transformation project into bringing the expertise of the Ministry of Defense. Ministry of Defense has been pioneering building medical capabilities, medical teams for the past 40 years or 50 years. And bringing the experience of M42, merging it with this culture. So what I see as an opportunity rather than a challenge is merging and marrying these two cultures, two thought processes to deliver something that is new, that will cater to the community. The good thing is that we have a shared vision. Both the Ministry of Defense and M42 share the goal and the target of serving the people, of delivering the best care. So I see an interest in looking how we bring these two cultures together from a military perspective and the civilian perspective to deliver something that will create a mark here.
Thank you. I'll open up the questions for the audience. Anybody in the audience want to ask a question? Okay, there are no questions. Dr. Jason, you have a? Oh. So let's continue, we have few minutes, so let's continue with the journey. Do you have, Dr. Abdalla, what are your plans for education, research, digitalization for this hospital? As a part of M42 umbrella now, you'll have a lot of support from the corporate team to deliver the care, not only the care, but also the supporting services and platform for supporting the clinicians for research and education. What is your take on that?
Okay, as Safeya said, now it's 30th of January, so 30 days since we started, and already I had a contact with many people, especially from the research. She probably somewhere here, I forget her name, from M42, just she's offering me how she could support me in the research and how the research is conducted in our facility. She's here. She's already contacted me a week ago, and we have a nice chat about planning the research in our organization, and how did we manage this service previously. In our organization, totally different way, because going from military or government sector to your sector is totally different experience for me. So I think this is one of the things which will be improving very fast, very quickly. Digitalization or other things, it depends on the service and the demand and the expansion. And that's something I think we could share from experience in many different locations, because part of the same organization, I don't think sharing experience will be difficult for us, or at least to get education or a feedback from someone you trust.
Thank you. Safeya, coming back to you, we would like to know, the audience would like to know about your plans on taking this hospital to the next level in terms of, you mentioned about expanding the scope of services, continuing the current M42 scope of services and bringing it to Sheikh Sultan bin Zayed Hospital. What kind of support you would need, and what kind of expectations do you have from the M42 corporate medical structure? And as Dr. Abdalla mentioned about the education, research, precision medicine, because this is the biggest hub and one of the biggest hospital in the Northern Emirates region. And it's one of M42's flagship hospital with emergency, operating room, dialysis services, inpatient services under one umbrella. So do you have any thoughts or dreams about it?
Well, I have so many dreams. I was waiting for this hospital to open because the way I look at it, you have to consider the market in totality. So Dubai, Sharjah, and the Northern Emirates cannot be divided because patients and the community and the nature of the community there travels across these borders and are always continuously looking for the best care. Now, how are we looking at the collaborations? It's important that we are part of the community. In the first few weeks, the first thing that we started is contacting the nearby hospitals, our colleagues, building the medico-collegial relationships, because you are part of a healthcare system, and it's important that you leverage these expertise. Actually, I want to take the opportunity to thank Dr. Abdalla, who is coming to us from the military world to join us and to leverage his experience and expertise in the medical military sector, but also in that region. Because it's important that we leverage these relationships in building our referral mechanism, our physicians networks, and building that foundation in order to leverage it into the next level. If we want to talk about centers of excellence, we need to be part of that community that is trusted to deliver excellence. So the support that I think it will be needed is through building the relationships, the partnerships, solidifying our position in the market. And then the next thing is leveraging the experience in the specific specialties that we've built our experience on in order to build to branch it out into that into the hospital. The third element and the final is on the M42 clinical governance structure. We recently had a massive new restructuring which enabled us to really look into the future. We now have focus on the medical governance, a focus on global patient care services, and that should enable us to really deep dive, instead of being horizontal, to deep dive into the medical world of research, public health, preventative medicine, research and education, and build all of that and reflect it as well in Sheikh Sultan Hospital, inshallah.
Well, these are wonderful words: clinical excellence, integration, partnership, collaboration, and then excelling that into governance, research, digitalization, and innovation. And these are the pillars of these hospitals. And congratulations for setting this up, starting it on day one. And we would all like to support you and be part of this success story. Thank you so much, Safeya and Dr. Abdalla.
Thank you. Thank you.
Thank you, everyone.